Right, I think you just have to confirm it's recording. Sorry about that. Over to you, Nick.
Brilliant, Kim. Thank you ever so much. Morning, everyone, and thank you so much for inviting me. It's great to see so many people here interested in FND, in children and young people. And a real privilege to I guess have a platform to talk about it, and to just share information and questions and ideas. So my name's Nick Schindler. I'm a paediatric consultant based at the Norfolk and Norwich. I have a special interest in epilepsy and neurology, and as part of that, started to see lots of young people with really quite profound symptoms around the time of the pandemic, and didn't quite have an answer for what was going on. And that led me into a journey into functional neurological disorders, and that's kind of why I'm here. And when I was asked if I would speak, I was sort of starting to wonder what do I add? What's useful? What's important to talk about? And I think I'm quite keen to present this as, I'm not here as an all-knowing expert. I'm not here as someone who runs some specialist quaternary clinic that takes referrals from all over. I'm here as a general paediatrician with an interest who sees lots of young people with a huge variety of conditions. And I would like kind of to dispel the myth that FND in young people is this rare or wonderful thing that we don't see, because actually we see it really often. It's very, very common. And functional neurological symptoms are something that is, I guess, a spectrum, if you want to use that term, from normal at one end, where we all get symptoms, things that our body experiences due to how our brain is working. So if we have a driving test or an exam, we might have tummy ache in the morning. We might go to the loo to open our bowels a little bit more. We might find ourselves a bit shaky and a bit agitated. But those are normal. That is a normal part of how your brain works and how it interacts with your body. And at the extreme level of that mechanism, our body can do things that we don't understand, or not do things that we want it to do, because of the way our physical body interacts with our brain. We have no other way of interpreting what goes on around us other than through our brain. So when I talk about FND and FND symptoms, I talk a lot about the brain rather than the person, because the bit that's you, the bit that's sort of up here, is only quite a small part of your brain, and there's a lot goes on that's not conscious thought. And it's really important for me that, particularly when we talk about young people, that we separate out this idea of them as an individual and their brain and FND symptoms, because there's a lot of blame attached to FND symptoms. There's a lot of this idea that somehow children and young people should be able to get over it, or they're making a fuss, or something not a big deal, or that things are, at the worst end of things, contrived or malicious. And that is absolutely not true. Children on the whole don't make things up. And certainly for the young people that I see with quite debilitating FND symptoms in some instances, couldn't do, even if I think they wanted to. And I spend a lot of my time talking to parents and schools and colleagues and other professionals, trying to promote an understanding of what FND is and how it works. Now, I'm hoping that for a lot of you, you've already got a degree of your own understanding because you're here and you're interested in this. Many of you might know young people or have FND symptoms yourselves, and you'll have an idea of what that means to you and your family and to others around you. And I'm not here to dispel or correct that or really change anything. I'm here to add, hopefully, my understanding of things. And what I wanted to do is have lots of Q&A rather than me chatting away and slides or data or anything like that, to try and make this as accessible and as useful as possible. The last bit I want to talk about really was what our service looks like, because I think I've had a lot of questions about the various different services that do or don't see young people with functional neurological symptoms, and that journey, particularly through the NHS, and sometimes through other providers. and how that may or may not work. So for us in Norwich, I run what is nominally a paediatric neurology clinic, but within that I see a great proportion of young people who have functional neurological symptoms. We take referrals from general practitioners, from other hospital professionals, from CAMS, and from the neurodevelopmental service and community paediatrics. So quite a wide variety of people who refer into our service. And some referrers will say, I think this young person has a functional neurological disorder. Some referrers will say, I don't know what this young person has, and will describe their symptoms. And quite often from that description, we can be confident enough, at least in a potential diagnosis, to stream them into the correct clinic. We don't always get it right, but often we're able to start in the right sort of place. And sometimes referrers will make a referral for something very distinct that they think is very clear, but something in the description that they make will give us pause and think, actually, that's not typical of that condition. And I wonder if it might be FND. And then we'll have a conversation as a team. There are 4 of us who work in the epilepsy neurology team at Norwich, and say, actually, who do we think is best placed to see this? And then, of course, sometimes young people meet other colleagues in other clinics, and it becomes apparent in the consultation that they have functional neurological symptoms, either wholly as the cause of their difficulties or partly, and then they'll get referred on to us after that. And our offering is quite varied, from coming to clinic to just meet me and have a 40-minute appointment in our outpatient clinic, all the way through to I often host a multidisciplinary clinic with one of my nurse consultant colleagues at CAMS, and one of the nurse practitioners in the neurodevelopmental service, who's actually an ADHD specialist nurse by background. And we do occasionally meet young people, all 3 of us together in clinic. I think our most bespoke clinic offering is 2 of us met a family who didn't feel able to enter the hospital for a variety of reasons in the back of their camper van in the hospital car park. And we certainly try to be as adaptable as possible to the needs of families and young people, because at the extreme end of the spectrum, FND can be really quite limiting for some families, and traditional hospital appointments aren't necessarily always going to be particularly accessible, but we still want them to be able to interact with our service and get the benefit of it. Where we go after that initial clinic meeting is again really varied, and lots of you might have had experiences of bouncing from pillar to post within different services, waiting for specialists here, there, and everywhere, or being told simply that actually there is no provision and there is no resource. And that is something that we've experienced and is really frustrating. Part of our service is trying to help families to navigate those channels and explore where might be most appropriate to support with specific symptoms. So, for instance, young people who have functional mobility difficulties, and they might be best served by support from our physiotherapists or our occupational therapists. Young people who have functional difficulties, but also have significant difficulties with anxiety or OCD, and they might be best served by meeting our colleagues in CAMS. Equally, we make a lot of provisional diagnoses around autism or ADHD in adolescents with FND, and we need to be able to plug those young people into our neurodisability service to try and have a formal assessment and a formal diagnosis in order to inform our next strategies. And sometimes young people need more than one of those. Quite often, and I'd say probably in more than half of cases, actually all that we need to do is provide a really clear explanation of symptoms and an understanding of what's going on, and a positive diagnosis. You might have heard people talk about FND being a diagnosis of exclusion, that they want to look for everything else and rule out other causes. And that's not our approach to FND. Really, functional neurological symptoms are quite distinct often. And it's often very clear, particularly for neurological type symptoms, what is going on. And it's vital that we're clear about that from the outset. If there's doubt, then I don't give an FND diagnosis. And we will explore those symptoms as appropriate from the neurology clinic. But if they're distinctly functional in origin, then I think it's incumbent on us to be clear very early on that actually we know what this is. We've seen it before. It doesn't need a brain scan just to check, or some blood tests just to check, or some course of spurious treatment that we think, oh, someone else said this might be helpful, so we're going to give it a go. Because actually that can be quite harmful. We do unnecessary things. We waste people's time. We keep them, children and young people, out of school. We put them through unpleasant procedures. And it's really vital that we can be clear and confident in our own minds about what is and what isn't going on, and do that from the outset. Now, occasionally something changes and it makes us question our diagnosis, and it's appropriate at that point to go back and look at things again. And I'm always keen to tell families that just because a young person has a functional neurological disorder doesn't mean they can't get other things. So they're still going to get coughs and colds and tonsillitis. They're still going to get tummy ache and tummy bugs. They still might get an appendicitis at some point. They still might have other stuff going on. And it's really vital that we don't see other symptoms get dismissed as FND just because a young person has had difficulties with FND before. And I quite often see young people back in clinic because GPs have said, oh, this new thing has cropped up and we don't know if it's FND or if it's something else. And that's really appropriate. And we try to fit those young people in pretty quickly, so that they're not wondering for a long time. Sometimes it's really clear what's going on. There are a relatively small number of sort of symptoms that we commonly see in FND in young people. And that can be quite useful to discuss with parents as to what they may expect in the future. And I certainly use a bit of a screening assessment, because often young people come with a specific problematic symptom, but when you discuss it, they have lots of other FND symptoms as well. It's not just the initial presenting difficulty, and often the history is much longer than is apparent. And as some of you might have experienced, often there are other things in the family as well, that when you're having that discussion, one of the parents in the room goes, oh, actually, that's me, I have that, I do that. And you see these sort of light bulb moments crop up, and I'm not an adult physician. I don't diagnose adults, and I have to be very careful and clear about that, that I'm not there for diagnosis for families as well. But we often see that happen. That doesn't mean that our service is wonderful. That doesn't mean that we're perfect and then we get everything right. And it doesn't mean that we can fix everything. And actually, often I spend a lot of time talking to young people and saying it's not about fixing FND. It's not about curing things, because actually for a lot of young people, this is just how their brain works. This is their normal. And it's more about understanding it. Because if you can understand neurological symptoms, quite often the disorder bit, the bit that gets in the way of life, the bit that disrupts stuff, goes away. Either because the fear of the symptoms has gone away, or because we can impart an understanding of how to manage them, how to trick the brain into doing what we want it to do, rather than what it has been doing. And the final part of that for me, before we go on to sort of questions and answers, because I think we'll touch on lots more stuff there, is that this distinction between mental and physical health, which we seem to have propagated in Western medicine, which is really unhelpful, because the two are completely inseparable. If you have a chronic physical health condition, you are likely at some point to have difficulties with your mental well-being. That is entirely understandable. If you have a chronic mental health condition, at some point you will have difficulties with your physical health as a result. The two are inextricably linked. FND is not a primary mental health condition, but neither is it purely a neurological condition. It's not unique, but it's very prominently straddling the two. And part of that is that if you've got functional neurological symptoms and you also have anxiety, or you also have autism, or you also have ADHD, those symptoms are going to be much more difficult to manage. A lot of how we deal with functional neurological symptoms is about engendering understanding and teaching young people how to master the less conscious parts of thought and of how their brain works. But if you already have a difficulty or a difference in how you think and how you process sensory information, then actually that can be a bit more difficult to do, because quite a lot of our therapists and team members are neurotypical. And it can be quite difficult as a neurotypical person to explain to someone else who has a learning difference or a thought difference how they might understand things. And we have to be quite humble in that and say, well, the ways I have of explaining and understanding things might not work for everyone. And I might have to try a slightly different tack. Or I might have to go and speak to a friend and say, have you ever come across this in a young person with autism, for example? How did you explain it? How did you get past that? Or if you didn't explain it, how do they now understand it? How have they come to that conclusion? And I think that's one of the wonderful things about charitable organisations, putting individuals in touch with each other, is that you get to explore the variety of ways that other people have encountered FND. Now, that doesn't mean they're right and you're wrong. That doesn't mean you're right and they're wrong, because brains are different and they work in different ways. But it does mean that you have options. So, for example, within the epilepsy team, we have a psychology service, which is relatively new to us and is absolutely fantastic. And they are partly commissioned for something called non-epileptic attack disorder. I find that a very strange name because it's also not an elephant, but we don't call it not an elephant disorder. And I've been trying to move our commissioners away from that diagnosis towards understanding most non-epileptic attacks as actually a form of FND. And we've been working really hard with our psychologists to do that. Now we have a couple of young people who really have struggled with the psychological therapy that comes with management of FND characterized by non-epileptic attacks, if we want to use that term. And there is no referral service beyond us. There is nothing beyond the support that we offer, other than referral to CAMHS if they may have a mental health component to their difficulties, which not all of them do. And so what we have to do is we have to go finding colleagues and friends elsewhere who might have done the same things and say, well, how did you manage this? So for me, my go-tos are, I did part of my training at Great Ormond Street, and I've also got some close friends and colleagues who work in the tandem team at the Evelina. And so what we tend to do is pick up the phone, or more likely pick up WhatsApp or email, and say, this is our case, what do you think? And we don't have a formal mechanism to do that. We tend to seek forgiveness rather than permission when it comes to the structures of the NHS. But we'll get together in a room, or more likely in a virtual room like this, and have a conversation about it and see what other people have offered in the past and what we might be able to offer in the future. And we're still going through that learning journey. I think lots of other colleagues and services are doing the same, and that means that the offering is really highly variable depending on people's understanding. And that's not great, and it's not okay. But hopefully over time, through those conversations and through things like this, I'm hoping that we can improve that. But we're not there yet. I'm hoping, after all that rambling, that it didn't.
Yeah, thanks for that, Nick. That was a really good explanation, and it is positive what services that you're doing up there in Norwich, and hopefully we'll see more. It's very much a postcode lottery at the moment, so hopefully we'll see more similar services. I know that when we've spoken before, it's difficulty with the funding side of it. So things like this Awareness Day are really important, so we can express the need for them. We also, I think, need to sort of move into CAMHS as well and do more awareness in there, because we know of a lot of young people that are stuck under CAMHS and not getting neurological support, for the neurological symptoms. So anyway, we've got a few questions. So what I'll do is I'll read through them, and then I'll try and avoid anything that's duplicated. So the first one is, my daughter had a sudden onset tic disorder and then NEED, which obviously is functional seizures, in January 2022. we're still working on managing this, and we're basically told to look at John Stone's website, which is quite a regular occurrence for
The
even adult care.
neurosymptoms.org website.
Yeah, that's quite regular for adults as well. Well, most of the time. Why do you think there has been an influx in young teenage girls since the pandemic?
That is a fantastic question. And that is absolutely the thing that got me interested in FND and working in this area, because we saw a huge influx. I also see young people with Tourettes, and we had this huge influx in young people who looked on the surface of things like they had Tourette's, but actually Tourette's is a really distinct condition. And the really key thing about Tourette's is that the movements and the vocalizations are voluntary, and they're in response to an unpleasant sensation or an urge, and therefore young people can suppress them. So as soon as a young person has a tic-like movement or a vocalization and is really clear that they can't suppress them, and they're old enough to be able to recognize that, so normally sort of 10, 11 plus, then you have to start thinking about what else is going on. And you're right, absolutely. Not necessarily going into lockdown, but it was coming out of lockdowns that seemed to be a really massive trigger for a lot of young people. And what we think has happened, and certainly what our experience is in Norwich, is that for a lot of young people who maybe have a bit of neurodiversity, so maybe don't have autism, but maybe have some difficulties with their sensory processing or their social communication, or just some differences in how that works. These were often young people who really liked lockdown. Lockdown was good for their brains. Their brain didn't have to process all that unwanted sensory information. And at the same time, what we also did was we deconditioned their brains from managing all of that information, all that processing that they were having to do on a daily basis. They didn't have to do anymore. And then after lockdown, quite suddenly, they got thrown back into this world where they were back to all the normal sensory stimulation, but there were also masks, and there was still worries about COVID, and there was lots of things going on for brains to do. And that is quite ripe food for FND. Now, it's not necessarily a straight line from that to functional tic-like movements. The phenomenon of functional tic-like movements itself is really interesting, because it seems to be quite socially driven. And one of Kim, when you emailed me earlier, there's another question later that we might touch on this. But functional neurological symptoms have always been around. They're not a new thing. Our understanding of them has changed. What we've called them has changed and evolved, and I think for the better. But what we see is that in different cultures around the world, they present very differently. And part of that is to do with how brains work and how brains learn. So if we were all in the same room and I was to yawn, quite a lot of you would yawn. Now, I've not transmitted some sort of weird yawning disease to you. That is how our brains are socially wired in order to pick up information of stuff around us. Children don't learn to walk by going to walking class. They learn to walk by observing other people walking. They don't learn to play football by going to football class. Most of them watch other people kick a ball and then kick a ball. And so with functional tics, it seems to be the same sort of way. If you're exposed to tics or tic-like movements, and your brain has seen those movements somewhere, that might be in friends or relatives. Equally, it might be on social media like TikTok or Snapchat. Then that makes your brain much more vulnerable to your FND manifesting in that way. So whereas traditionally we might have seen a lot of what we call non-epileptic attacks, instead, post-pandemic, for a variety of reasons, we started to see a lot more functional tic-like movements. I think we're certainly in Norfolk, we are seeing those, at least the prevalence of functional tic-like movements reduce considerably. And we are seeing much more of a return to either functional movement disorders, so things like paralysis, or non-epileptic attacks, which I think were more prevalent prior to the pandemic. We know from across Europe from studies that equally how things look in different countries, they've seen the same phenomena, but they've seen a different representation of that. We know, for instance, that in places like India and Pakistan, functional blindness is much, much more common than tic-like movements or non-epileptic attacks. That seems to be in those places how FND manifests. and I'm sure we will see more shifts in the future. And we have to be quite careful to guard against that, and to guard against turning them into specific things like we sometimes do with non-epileptic attack disorder, rather than recognizing it as part of a wider FND sort of syndrome, if that makes sense.
Yeah, can I just ask, Nick, because obviously it was in the media a lot about the TikToks and the tics from TikToks. Is that not necessarily, because that's very much like a conversion theory, seeing someone do that symptom. Is it not more so with the lockdown and people, their heightened stress, not being able to go out, that heightened it, rather than seeing someone physically have? I know in Tourette's it can catch, but they've already got the Tourette's diagnosis in the first place. But would it be the mental health of the person, or the child being stuck indoors? You know, would that be more applicable rather than actually seeing someone, you know, have a yawn, you know, like the yawn?
Yeah, great question. I genuinely think it's a really big combination of all of those things. If you have difficulties with your mental health and well-being, you are more vulnerable to functional symptoms. It doesn't cause them. You already have that. Your brain already works and processes information in that way, but it makes you much more vulnerable to them, and it makes you much more vulnerable to them persisting. So, you know, tics and tic-like movements are very common. But they wax and wane quite quickly, and people find them very easy to suppress. If you are very anxious coming out of lockdown, and you've had a quite difficult experience, and you're struggling with your sensory processing, and you have some tic-like movements, or some actual tics, even if you might not have Tourette's. There are lots of people who have tics that don't meet diagnostic criteria for Tourette's. Then you are much more vulnerable to both FND symptoms, but also for those lasting for a longer period of time. So it's not, I think we've made an artificial distinction between some conditions that probably doesn't quite work in the way that we might have originally suggested. And Tourette's is a very distinct condition, but young people with Tourette's are also vulnerable to FND. And I do have young people in clinic who do have, and have, you know, for a long time had Tourette's and classical tics, who have then gone on to develop things that aren't explainable by their Tourette's and are much more consistent with also having a coexisting FND. It doesn't have to exist in isolation.
Can I just ask what the differentiation is? So a Tourette's tic and a functional tic, just so in case people don't know.
Tourette's is a neurodevelopmental syndrome. We think we know it's genetic. We just don't know what the cause is. We don't think it's one gene. We think very much like autism and ADHD, it's regulated by quite a number of genes. It's quite a complex thing. And the characteristic things of Tourette's, so the diagnostic criteria for Tourette's is you have to have multiple motor and at least one vocal tic. They have to have started before the age of 18, and they have to have persisted for over a year. Now, the key bit of that is understanding what a classical Tourette's-like tic is. So, as we were saying earlier, in Tourette's, the movements or the vocalizations are voluntary, they're deliberate. And that doesn't mean they can be controlled by everyone, but they are voluntary. And they're in response to, the fancy medical term is a premonitory urge. But essentially, I describe it to most young people as it's like either an itch or a compulsion. And doing the movement or the vocalization makes the itch or the compulsion go away. And most teenagers can recognize their premonitory urge really well and really clearly. But because the movement or the vocalization is intentional in Tourette's, it doesn't get in the way of intentional movement. So people with Tourette's can still drive a car, they can still write, they can still, I think the classic TikTok thing was make an omelette, they can still crack an egg. As soon as you start seeing people not being able to do something they want to do because of a movement or a vocalization, that is not Tourette's. So as soon as they're throwing an egg across the room, or they can't control their hand to write, or they can't get their legs to work, that by definition is not a classical tic, and you have to start thinking about something else. I hope that makes sense.
Yeah, and I'm just seeing one of the last questions, just carrying on from functional tics. like someone's asking that their child has had Tourette's for years and now has functional tics, and they've been told treatment for functional tics are different to behavioural tics. I'm not
Yes.
sure, but how are they being treated? And they said they've been rejected from a treatment clinic for Tourette's due to the additional functional tics.
Yes, that is our experience as well. So there are not very many treatment clinics for Tourette's. There are a small number of very reputable private providers, and there are a small number of very excellent NHS providers, mostly based in London, at either Great Ormond Street or the Evelina. But actually services outside of that for Tourette's are also pretty lacking. But they're absolutely right in that because the origin of those tics is very different, subtle, but very different, all the Tourette's psychological therapies center around recognizing the tic urge and being able to sit with it, being able to tolerate it without acting on it. That doesn't work in FND because the movements in FND are not voluntary. And so as soon as you're sort of into that, you're onto a bit of a non-starter. So with FND management, the FND, the therapy has to be much more centered around a much more holistic view of the young person and their interactions, and possibly particularly in things like non-epileptic attack disorder, the precipitating factor to events. And the effectiveness is much more different. And I think we're not there yet on psychological therapies directed specifically at FND. In some respects, but particularly for functional movement disorder, actually the psychological therapies in our experience aren't great, and it's much more helpful to do things like physiotherapy and occupational therapy, and to retrain intentional movement and to step away from the thought side of things, because actually the thought side of things can often make FND worse if you focus on it. That's our local experience anyway. Our greatest successes with functional movement difficulties have been through our physio service, not through our psychology service. But I think it's really important that we keep in mind that young people are different. They have different understandings of their own bodies, and what one young person might respond very well to is going to be different to another. And it's helpful for us to have a more bespoke offering rather than saying, oh, you have FND, you go into our FND pathway. Oh, you have Tourette's, you go into our Tourette's pathway. Because actually, it's not that, they're not FND. They are a young person who's experiencing FND, and we have to direct the treatment appropriately.
That's great. So just going on about just keeping on the brain, when people are young, because obviously the brain doesn't develop till you're in the early 20s, isn't it? Do young people have a better chance of recovering from symptoms because their brain isn't matured enough? Have you seen a better recovery rate than adult?
So the truth to that is we don't know yet. I mean, I personally, from a practice point of view, I don't see adults. I haven't done adult medicine for more than 10 years now. The adults were much quicker to understand FND than I think we were in paediatrics. It's still a relatively new thing for us. We know that there is a significant risk of having functional neurological symptoms or other difficulties in adulthood if you have experienced FND in childhood. But we also know that a large proportion of young people will, with therapy or sometimes quite often without therapy, move past functional neurological symptoms and will no longer have the disordered bit that comes with it. It will no longer interfere. I particularly see that in the transition out from normal school to college or to university. It seems to be that once young people get a bit more self-determination and self-regulation, that significantly improves functional symptoms. I think a lot of colleagues have mistaken that in the past for school refusal and said, well, in the summer holidays, everything gets better, or it gets much better. Or if they don't go to school, things get much better. Now, that's not because school is the problem in a conventional way. That is because school, in terms of cognitive load on the brain and processing power, is incredibly demanding. And as soon as a young person is able to manage that demand much better, we often see those symptoms become much more manageable. So I spend a lot of time talking to schools and Senkos and other people about adaptive timetables and bespoke educational offering, because that can be a really effective intervention. Sometimes it's not about fixing the young person. Sometimes it's about fixing the ridiculous things that we ask young people to do as part of their day-to-day school activity. And if I was a teenager and my brain doesn't naturally want me to fall asleep until 11:30, 12 o'clock at night, but I've got to get up at 7:30 in the morning to go to school, so I'm a bit sleep deprived, then I have to jump through all these hoops for lessons that I don't really understand. I have to navigate my friends, I have to navigate the people who aren't really friends, all those noises, all that sensory input. Then it's not surprising that if I've got difficulties with FND, I'm going to have worse symptoms and they're going to be more impactful. And that actually, if I was able to do the subjects that really mean something to me, and I was able to sleep later in the morning, and I was able to have a bit more control, that actually my symptoms are going to be a lot more manageable. And I think that the same thing applies to lots of chronic health conditions as well. It's not unique to FND, but I think sometimes I spend a lot of my time reminding schools that actually the young person is the one who is important here, and that fitting into the box isn't necessarily always the priority.
Okay, that's great. Somebody's asking what the core symptoms are of FND that you see regularly at your clinic. What?
Yeah, so I think the commonest cluster of things I see, and again, if you've been on the neurosymptoms.org website, a lot of them are well represented there. The commonest cluster of things we see are functional tic-like movements, although, as I say, I do think that is reducing. Functional dissociation, or what is traditionally called non-epileptic attack disorder, that sort of comes into that. Functional movement difficulties, particularly hands, jaw, and legs, seem to be the most common. But they come in varieties, and normally that is around an activity. So it's hands get stuck or are painful or are weak, and that means that a young person has difficulty with writing or with physical activity, or legs feel weak or numb, or feel like they're not there, and therefore a young person has difficulty with walking, but symptoms might not be present at other times. We do see a variety of other things, and I know that some of the recent studies, particularly there's an Edinburgh team who've been looking at the constellation of functional symptoms in young people. Their net is slightly wider. They talk a lot more about functional headache, functional abdominal pain. Those are absolutely a thing, but I think they are much more difficult to diagnose. So I see a lot of young people with functional movement disorders, functional tics, who also have a background of migraine or chronic headache or intermittent abdominal pain. And in hindsight, it is likely that those other symptoms have a functional element to them. If by pure definition, migraine is probably in part a functional neurological disorder. We know that when migraine is a thing. Lots of us have had migraines. But if you scan the brain of someone with a migraine, you won't find anything. If you chop it up into tiny slices and look at it under a microscope, you won't find anything. It is to do with how the brain processes sensory information, which is exactly what FND is. And I do wonder if in 10 years' time, we will understand migraine in the same way that we understand FND. I've heard other people suggest that before, but that is not my area of expertise. They often coexist. But my understanding is that for adults more so than young people, migraine and FND often coexist. And that's interesting. We know that there are effective pharmacological treatments for migraine. We don't yet have any effective pharmacological treatments for FND. So I think those are interesting avenues for us to look at in the future.
So on that line then, somebody's asked if there's any links of using antidepressants and triggering FND. And I know that they could be maybe symptoms that are as a consequence of the antidepressants, but are you finding people developing FND and then after being taken medication?
So again, it is really individual and bespoke. So if you have depression and you also have FND separately, your depression is likely to make your FND worse, and your FND is likely to make your depression worse. So treating the depression is a really good idea. And for those young people, I refer them on to whichever tier of, we say CAMS, but CAMS isn't really a thing individually. CAMS is an umbrella term that represents children's mental health services. So we have there's about 7 or 8 different teams that represent CAMS in the east of England. So I will, if there is depression, I will refer on, and I will make it very explicit the referral is for depression, that they also have FND, but that is not the reason for the referral. The referral is for depression. Equally, we know that children and young people don't always present with depression in the same way that adults do, or the stereotypical picture of depression. They might present more with anxiety, or they might present more with sleep difficulties, rather than saying I'm sad or looking sad, or sort of things of that nature. So in answer to, I guess the short answer is, I don't think that the antidepressants are a specific treatment for FND, but we have to screen for coexisting conditions like depression, and we should treat those with evidence-based treatments where we find them, because optimizing everything will help FND. The example I tend to give in clinic is like being an athlete. So being a teenager is like being an athlete. And when you are an athlete, you work on everything. So you don't just train for your sport, but you work on your sleep, you work on your diet, you work on your mental health, you work on your dental health. Those things are all really important to being an athlete. And exactly the same goes for FND. If you can optimize all those other parts of your life, even a little bit, you don't have to make them perfect, but if you can make all of those things a little bit better, you will help FND. And it's not about a fix, because there's nothing, it's not always that there's something wrong. It's just that there's something different. And it's about making that difference as manageable as possible for the young person.
Thank you for that. So we've had a couple of questions about links to autism and ASD, ADHD. Is there any evidence showing that there are links, or any research currently in paediatric care that there is?
So there's lots of ongoing research, which is great. I'm not, and I deliberately didn't come here with sort of stats and slides and things like that, because I wanted to have a much more human conversation. Our experience in Norwich is that there are a significant number, particularly of women and girls, who have undiagnosed social communication difficulties. And I use that term because autism is a social communication disorder, but not all social communication disorders are autism. Not everyone will meet that threshold. But when we meet young people who have clear FND, they often have particularly for the functional tics, lots of you might recognize that there is often a day that things start. Often young people can tell me, it was this day, I was doing this, and this is when my symptoms started. And there's a really sudden onset. But when you go back in the history and you spend a lot of time looking at things, actually, when they were younger, there were some sensory difficulties. There were some difficulties with food textures, or with clothes, or with sound, and sensory processing. And so we definitely see that link. I don't know how useful diagnosis is at that point, but I'm currently very pro formal assessment. We are not an autism assessment service. That process is long and difficult. But I spend a lot of my time trying to support families to navigate the system and to get a formal assessment, because sometimes understanding those difficulties is then very helpful in understanding the FND, because a young person with autism might describe their symptoms very differently to how you or I might describe our symptoms. So it's great to help us understand, but it's then also good at helping to manage strategies around that. Because if we're talking about really quite complex sensory processing explanations, a young person with a sensory processing difficulty or with autism might really struggle to understand some of those things, and we need to change our tack. They might struggle to understand some of the metaphors and the examples we use. My normal chat about athletes or about how brains work might not work for a young person who doesn't get metaphor. And so I have to find a different way to explain those things for that young person.
Okay, that's great. Just going back, because the person who asked about the antidepressants, I probably didn't explain it clearly enough about it, but it's about being triggered. So any medication, can it trigger the onset of FND? In adult care, we're seeing an influx of people that have had, I'm not getting into conspiracy theories or anything like that, but we have seen an influx of people who have had the vaccine, and obviously antidepressants work in the same way because it changes the chemistry of the brain. So is there potential that medication can trigger?
So I want to be really unequivocally clear that there is no evidence that medicines or vaccinations or any therapies trigger FND. My impression is that FND, for most people who experience it, is part of how their brain has always worked. The potential has always been there. There might be sentinel events that are either associated in time or that get badged to the onset of symptoms. That might be a stressful life event. That might be the pandemic or lockdowns. It might be a medicine. But they are not necessarily there's no evidence that they are the direct cause. But as human beings, we love cause and effect. We're absolutely wired to find something to explain the phenomenon that we see. It's a really great survival trait to make those links and to make them quickly. Because if you notice that eating the red berries made your friend sick, you don't want to eat the red berries. You have to make that link really quickly. But unfortunately, we sometimes now do it too quickly. And so we blame the thing that we think we can control. We see this a lot with food allergies with children, on a totally different subject. Lots of people go, oh, my child is allergic to all these things because every time they eat them, they get tummy pain. And actually, quite often when I see those young people in clinic, they've got constipation, and it's not what they've eaten, it's just the fact that they have eaten that is actually the cause. But we like to think that we can control these things, and so we blame them. But I'm open-minded. If there is evidence to the contrary in the future, I will absolutely change my opinion. But as things stand at the moment, there is no evidence that medications or vaccinations or anything like that can trigger FND. And I think really quite I'm really quite clear on that. Because I always worry that we demonize a great host of things, some of which can be very important and very useful, because we're worried about their impact on young people or our brains or our physical health. And there's definitely no evidence of it at the moment.
Okay, thanks for that, Nick. A couple of people have asked about chronic pain and what services are available in paediatric care for pain, or even just your services at the moment.
So chronic pain is another one of those things that has always existed and that we've managed for a very long time. And that understanding FND gives us a really helpful way to understand some people with chronic pain. Not everyone, and FND is not the panacea to all things as an understanding. But there are certainly young people. I have young people in my service who have maybe hypermobility, have either frequent dislocations or the perception of dislocations, and who can be well understood through the lens of FND. But again, anyone with a chronic health condition is likely to at some point have an element of a functional neurological disorder, with things like phantom limbs. So phantom limb pain is a functional neurological disorder. It is something that is caused by the brain's abnormal perception. Now, that person is still missing a limb. There is a very tangible thing that has led to those symptoms, but the mechanism that those symptoms occur it is understood by FND. And chronic pain is very much the same. So often there is an original insult be that an illness or an injury, or a procedure, a surgery, that the brain then can't let go of. And it continues to try to protect that limb or that body part, or continues to focus on those symptoms, even though the original cause is long gone. And some FND management strategies can be really helpful in that course. In terms of the question about referral services, our referral service for chronic pain for children and young people is Great Ormond Street. They have a very excellent pain clinic. I am aware of families who have not got on with them. And that is difficult, particularly in the realms of functional neurological disorder. Sometimes you meet someone who you just don't click with, and actually a lot of our understanding and explanation, you need to trust the person that you're talking to. These concepts are very abstract. They are quite difficult and complicated. And if you don't trust the clinician or the professional that you're with, that is going to make those conversations really hard. And so I think it is a great shame that we don't have more services, because it kind of means, you know, if you didn't get on with the pain clinic at Great Ormond Street, you don't have many other places to go. But they are our referral service, and my experience is that they are very good, and we have seen some really excellent results. But again, sadly, not everyone. Oh, I ended up muted briefly. Okay. I hope you got all of that.
Sorry, I just muted you. I'm ever so sorry. Right, okay, so we've got some specific questions here. Would it be possible, Nick, if I sent them to you, because they're personal questions, just to give some advice? Obviously you can't.
So you'll have to forgive me. I can't give specific medical advice because I've not got the ability to take a full history and do an examination. So I would say generically in answer to those sorts of questions, I know that people have very variable experiences of general practice. Please see your GP. If you don't feel like you're getting anywhere, please ask for a referral to a paediatrician. And please feel able to sit with a paediatrician and say, look, I'm wondering about FND. These are the resources that I've found. I've been to this talk and listened. You can blame me if you want to. Plenty of my colleagues do. And start those conversations. It might be that your paediatrician or your GP says, do you know what? This is not my wheelhouse, and I'm going to have to go away and look things up, and that's okay. You want that. You don't want someone who's going to talk out of their behind at you. I would much rather see a professional or myself in clinic say, do you know what? Actually, this doesn't fit my molds. This doesn't fit my understanding. I'm going to go away and talk to my colleagues and look it up, and I'm going to come back to you. Then someone made up or that I made up an answer. I'm not for that. I don't sell that to people. I think that is dangerous practice at worst. So please feel able to question things, but don't feel like the person in front of you is going to have the answer then and there straight away. But it's important that young people with any symptoms have the opportunity to give a full history and are fully examined. And for that reason, via social media or email or even on the telephone, I try very hard not to give individual advice or diagnosis, because it's not safe and it's not good practice. So
is there, in your area, is there a clinical pathway for young people with FND? Or is there a proposed pathway, do you know, in the other area? Because obviously I'm just reading some people struggle with CAMS and, you know, the services that are out there, so they can't get initial help from paediatrics. So, yeah.
So we have a, sorry, Kim.
Yeah, no, so is there a pathway, or would you recommend a pathway so people can try and at least speak to their doctors about, you know, which avenues to take?
Absolutely. So we have a proposed pathway that's in the workings. I guess we have an informal pathway, which is me at the moment, and I sort of distribute referral and discuss with people. As we have a paediatric neurodisability and mental health multidisciplinary team meeting that happens on Teams once a month in Norfolk, between myself from paediatrics, the paediatric community team, and the various different services in CAMS. Now that's been running for a long time and it has different purposes. often to do with mental health as much as it is to do with neurological symptoms. But I found that a very effective mechanism. Sometimes we're more effective than at other times, but for me it's been really useful. We are trying to formalize that. In order to do that, we're waiting for the tandem team at the Evelina, who've done a lot of research in this area, I think I'm right in saying due fairly soon to publish their proposals for a generic pathway as to what local services might look like, and I'm really looking forwards to that. I think it will be very helpful because it will come with an evidence base to it, and that is always useful for us, particularly when it comes to commissioners. What I would urge all of you, because you're here, you're clearly motivated, go and speak to or try and contact both your MPs and whoever represents children's health at your integrated care board, your ICB, which are the new commissioning services for the NHS. They hold the money, they hold the power. If you can speak to them and get them interested in FND and understanding FND, they are the people who will fund our services of the future. That is how we got our epilepsy psychologists, because really articulate parents managed to sort of lobby our ICB and managed to get us money for a trial service, which was so successful that we have more long-term funding for a psychology service. We need the same for FND. But if I go as a special interest consultant and say, I need this service, they go, well, yeah, of course you'd say that. You're the one who we're going to be paying. What I need is parents and families to go and say, we need this service, and for them to start thinking about it. What I don't want to happen, that we've seen in other spaces, is that private providers who are of much more variable quality and don't have the quality control that we do in the NHS. I know we're not perfect in the NHS by a long distance, but our checks and balances are robust. And I worry about other practitioners filling the space that we leave, and at the least taking a significant amount of money for not really doing anything, and at the worst promoting sort of harmful treatments and management strategies. So we need to have a good NHS offering in order to be able to safeguard and best serve children and young people and families.
Okay, thanks for that, Nick. Yeah, because I know someone's just said that their FND service is shut down because of funding, and I think obviously we've got 3 charities here. We can be quite influential in changing that as well and connect with the ICBs. I know in the southwest there's a lot of work being done with the counsellors, aren't you, with the FND friends, so we can influence that. I just wanted to finish off with a couple of things, just in regards to paediatric care for FND and resources. Is there anything people can obtain online? I know there's Neurokid, the Neurokid website. I don't know if you recommend that. And I know Great Ormond Street have an information sheet, but I think they may need to sort of revisit that a bit because it's very psych orientated.
Yeah.
Is there anything else? Is there anything available in your area where people can access? Or
so my first port of call is I recommend that neurosymptoms.org website. I think it is clear. I think it is helpful. It doesn't give all the answers, but it's something. For functional tic-like movements, we've been really clear that they're not Tourette's, but actually Tourette's Action have some very good resources and are a wonderful organisation. Particularly for functional tics, that can be helpful. You don't have to have Tourette's to access their services or a diagnosis to access their services. And their website, is particularly around school stuff as well, is really excellent. I haven't found anything else actually. The Evelina team have some information leaflets the same way that the Great Ormond Street team do. I think theirs are possibly a little bit more helpful. I have used them on occasion. I'm hoping that there will be more in the relatively near future. I would love to have the time to draw up resources. I guess as a union of charities, if that is something that you feel able to work on, and I guess it really sadly able to fund, then maybe approaching the Royal College of Paediatrics and Child Health, and RCPCH have a branch called And Us, which is the Children and Young People's Group, and they have in the past around other conditions done some absolutely fantastic resources. If again, it's very sadly funding dependent, but RCPCH have produced nice guidance for rare conditions in children and young people like stroke, which are excellent, and I think we would really benefit from a formal nice guideline on the management of functional neurological disorders in children and young people. And the only barrier to that currently, I think, is money, because the NICE process is very formal, it's very strict, you have to do it all by the book, and you have to pay for it, which is have the potential to really revolutionise FND services. It would give us something to go to the commissioners with and say, look, this is best practice. You know, we need to be able to offer this. This is what the evidence says. This is what NICE say. And I'm really hopeful that in the next 5-10 years we can get there. But I recognise that for our young people, and FND, you know, disproportionately impacts, you know, teenagers, especially teenagers who are around GCSEs and A levels. You know, it's, you know, diagnosis and treatment for those young people is kind of time critical. It's a really important life stage, and that's really difficult.
Thank you so much for that, Nick. It's been, I'm hoping I've covered a lot of the questions. I haven't read them word for word, but what I will say, if you have got any additional questions that we can talk general about, I'll speak to Nick about it. So if you either, it's probably better to email one of the charities and then we can forward to Nick. Thank you so much for Nick for coming. And I just want to just finally let people know, if they don't know already, we started a campaign last October called Inform the Doctor, and myself, I can see Tom's online as well. We put together an information sheet, it's 4 sheets, and to give to the GPs or anybody in hospitals, anybody. I just wanted to let people know that it, you know, it will cover paediatric care as well, and that we will now send it directly to the people, to the hospitals, etc., on their behalf. So we've got it on our Awareness Day page, and then we'll put it separately on the website once it's done. We are going to, this is like the first phase of the campaign, so we have got some of the phases to come of it. So, but it's all about educating, letting people know. I think oh gosh, we've got some more. Oh, I think most people are saying thank you. Everyone's saying thank you, Nick.
Thank you, everyone. Kim, could I add one more thing before we finish?
Yeah, please do.
I think my last thing is that functional neurological disorders for children and young people are a chronic health condition, and all chronic health conditions take a big toll on the whole family. And there's probably a lot of parents here, and there's a lot of grief that goes into looking after a young person who's got difficult FND symptoms, because there is a lot of loss of what you think would otherwise have been. And it is really important that as parents, we feel that we can seek support for that. The young person is absolutely important to all of us. They are the centre of everything, but we still have to look after our own mental health and well-being, our own physical health and well-being at the same time. I have, you know, families where parents have given up work, where parents have given up things that they love, where other siblings have been significantly impacted. And it is really important that we don't lose sight of that, and that you also seek support for yourself or for siblings around managing the whole family, because FND is often a family illness as much as it is experienced by the individual young person. It affects everyone else. So it's great to focus on them, and it's also right to focus on parents and siblings as well. So please don't forget yourselves in all of that.
Yeah, and I just to pick up as well, because someone's just said it, there's big issues, isn't there, when it's transferred from paediatric care to adult care. And I know from our perspective, the charity, if young people are age 17, they're stuck. They seem to be like one service to another. Can I just ask how you, just a quick question, how you transfer to adult, how do your children go to adult care? What process should happen?
So this is not unique to FND or any specific, that with the exception of a few very well-resourced conditions like diabetes and epilepsy. This is a huge issue. There is this big gap in commissioned services between 16 and 18. The answer, I would love to say that we had a transition model. We don't. Our adult neurology team will diagnose FND and then discharge. They have no ongoing care service. And so I'm quite cheeky. I hold on to some of my patients for longer than we are paid to effectively. And we do that. I do that because I don't think there's an alternative, and I'm not prepared to boot people out of the door just because they had a birthday. But it is a really big problem and a gap in our commissioning, and again something that needs to be addressed. Some young people have fantastic GPs, and GPs are great, but they are doing a very difficult job at the moment. We haven't seen an increase in GP numbers for more than a decade, and the population has definitely gone up, and so has the health need, and so that is the stark reality that we all have to address. Now, there are places where charitable organisations like yourselves have really sort of stepped into providing support and information, and I'm hopeful that we can grow that, but it shouldn't be on charities to provide something that the NHS should be able to do.
That's great. Thank you. Thanks so much for coming, and we'll put it to a close now. Thank you.
Thank you,
just
everyone.
to remind that it's the next session's at 3 o'clock this afternoon, where Irene who's positive self-coaching for young people. So she'll be looking at things like CBT mindfulness. So if there is any young people on here, they may want to join it, or parents who they think young people are interested in it. But thank you so much. And we'll see you this afternoon or see you in a while. Take care. Bye.
Thanks.
Thank you so much, Nick.